Provider tools, some of them you have in your packets today. And what we mean to do is to provide you with information that is transparent. If you have an issue, then you should call me and I'll help you through it. All of the things in the packet, even if they don't apply to your specific specialty, something in there can help you. There's outpatient referral guidelines which explain for each particular patient, based on each specialty, what would need a referral and what wouldn't, what needs an authorization, which doesn't, as well as important phone numbers for you to know to get in touch with the various departments inside of Johns Hopkins HealthCare. We will conduct training seminars like this. I will come out to your office and work with your staff to make sure that there's a clear understanding of what you need to do with Johns Hopkins HealthCare. Not only do I meet with physicians, but also with office managers, office staff, claims managers, referral coordinators, your billing department, to try to help you through in filing your claims correctly, making sure that you get reimbursed promptly. We want to make sure that the policies that we pass out to you are updated. We post everything you see in your packet is available online. jhhc.com. I encourage you in your spare time to go there and take a look. We update our policies regularly to try to make them better. We try to move things so that referrals not needed. We try as hard as we can to make sure that our providers have everything that they need really to work with inside Johns Hopkins HealthCare. In Maryland, we have 9 network managers. Our director is Dina Goldberg. I handle Montgomery, Prince George's, Washington, D.C., and Northern Virginia. And all of us are here to help you. Out front, Lori LaPiccolo and Sandy Moore, they're network managers from other parts of the state that came to help here tonight. All of us, we train our providers. We try to not only sign providers to contracts, but make sure that providers can work within our networks easily, that they have the tools in hand to know so that you don't have issues filing your claims. Come on. I want to also talk here a little bit about HealthLink. What HealthLink is a tool online to provide you with the information that before you had to go to McNet to register. This is right on the web, and you can really find a lot of detail there. Not only can you check subscriber benefits, but you can also pull down your patient rosters. You'll be welcome back when you get back onto the page after you register, and you register by person in your office. Generally, the office manager is the administrator, and then the office manager signs first, and then assigns her staff from there, her or his staff, I should say, to move forward so that everyone in your office has access with their own passwords. It's a little difficult to read, and I don't know if you can see that, but on the left-hand side there are all the various services that you have inside of HealthLink. If you go to jhhc.com, registration is right on the right-hand side of that page. Some of the tools that you'll see on there, we certainly will take electronic claims from you. We have already interfaced with most of the EDI clearinghouses that are in the area. Our payer IDs are within the packets that you have there in case you do need those. We will do electronic funds transfer into your checkbox if you seek that. Our website, again, is www.jhhc.com. And important, and one of the things that you should do if you haven't already registered is please do that. It's a way for when patients come into your office, you can check their subscriber benefits. If you need to file a claim and you don't have a clearinghouse, you can file it right on HealthLink. If you have patient rosters that you need, you can pull your rosters anytime that you want to. So certainly a lot of benefit in HealthLink, and something that we think, again, helps us to be transparent to your practice. manuals that we have online there for all 3 of our lines of business. In your packets, you have quick reference guides for Priority Partners, EHP, and USFHP. Those guidelines are handy tools that will tell you what you need, whether it's a referral or not, whether it's an authorization or not. We give you a quarterly newsletter, particularly once you're in network. It's important. One of the things that can link you to the other physicians that are in the community, medical information that can be new and informative to your practice, you'll find in your quarterly newsletter. Each year you'll get formulary guidelines, which will help you to understand the drugs that are within the formulary that we have. Again, online, you'll find those at jhhc.com. Our provider relations department, you can certainly have my card there, but you can call us at 888-895-4998, toll free. And you can again go to jhhc.com to find your network manager.